Inadequate personal protective equipment for frontline health workers across the country has not only put the lives of health workers at risk, but also persons who may have the disease. In the Western region, several hospitals have recorded COVID-19 cases among staff, with the Tarkwa Municipal Health Directorate alone recording 23 cases. The health director, Caroline Otu, tells Citi News the situation is clearly as a result of inadequate PPEs.
At the moment, we have 62 positive cases, and out of this, 23 are health workers. Out of the 23, we have lost one. But this person was somebody who had a comorbidity. But the rest, as I speak, all of them are doing well. You know, Tarkwa has a lot of private hospitals and a number of mining hospitals, and then 2 public hospitals. So the numbers are quite big. That is why maybe we have fallen victim in this way. But it also boils down to availability of PPEs. Until recently, we didn't have enough. Last week, we received some from our regional health directorate, and we're still expecting more.
In spite of the difficulties and the risk health personnel face in the discharge of their duties, health workers at the Tarkwa Apinto Government Hospital have been able to deliver a pregnant woman who is COVID-19 positive. The medical superintendent, Dr. Baidoe-Ansah, who led the Cesarean section, spoke to Citi News.
In fact, the oldest government hospital in Ghana was built in the year 1881. We have also been doing our best as far as the COVID-19 pandemic is concerned. Currently, we have 20 confirmed cases. 2 of them are on admission that we are managing here. The rest are self-isolating, and our team is actually on the ground observing them. The patients on admission, one of them, a pregnant woman who went into labor and had difficulty with delivery. We tried to use a vacuum to deliver the baby. It was not successful, so eventually we had to go to theater and do a cesarean section for her. She's doing well. The baby is also doing well.
The actual isolation center that has to serve cases here at the Apinto Government Hospital in Tarkwa is currently not ready. And so they have a makeshift one that they are using. And so we have the privilege to currently go in there and interact with this patient who has successfully been delivered, a bouncing baby. We have the patient here who has actually gone through a very successful CS to have her baby, but we don't want to show her face. We only want to share, get her to share with us her experience and her happiness and what she has to say to hospital officials over here. Madam,
can you do my
can you do the picture? I didn't know about
Namenim, let me say, me boa. Number to say, one day and I drew then I say, so Timbana must say, me wore asthma, and that be. Mini asthma. I say, pneumonia, like I said, Jimmy. Let me say, okay. No, I'm going to call word. Tarachi and Madame, Mrs. Doctor said, I be. Only me through one of them to. And now, a man me bedroom, I say.
Now, then I see.
Oh, remember, I mean, Yamiado. The fan can manage, you know. A yet din dear, by Yame, I hear. Emma, see my wife from about. Only me, CS, and submit me in your Aqualana. Beniaji Bibre. Look at there, with the Omunase, Yamin Shilom. So almost me a sum. Say I will go about to Suru. But I want the moon Suru, almost the German chaff, and making me our. The Dominasi, I mean, Inshon. See, dear, me be fear for Governor, almost Caesarean and be a material misro. By yes, I do, may no be a Sunday, or by Jimmy, the TB.
The stigma that this nursing mother faces is something that Gifty Ida, a COVID-19 case manager, is also facing when she closes from work.
Before COVID, I was able to talk to my friends, go and visit them and all that. But because COVID is now here and then I'm part of the team, I'm not able to go and visit my friends as I used to. And they're all scared that one way or the other, as we nurse patients, we might get infected. So all that they say is that they are praying for us. And then secondly, you cannot move from this isolation to a different ward. And then it's very difficult.
Despite this, Dr. Joseph Darkon and Anthony Atawra, an anesthetist, says the delivery is a moral booster. They are, however, calling for more logistics.
For us, it's an achievement because it's actually the first in the region, actually, and it means a lot for us, considering our constraints. I mean, you can even see the structures that we have, quite old, and even the PPEs. We had to use a whole lot of PPEs for just this case. So for us, it's a huge achievement. I mean, if you look at, on that very day, it was actually a bittersweet day for us.
Where we are keeping the patient now is temporary place that we have to, because we had confirmed cases that when the place was not ready. And what do? You can't push to anywhere else once you identify, so temporarily we have to cope with it. The assembly came in to do some work, at least to a certain level. But being an isolation center, there are certain other things that needed to be put in place. Those things are still not yet in place for us to use, and all has to do with the resources. Because we need monitors at the place, even the place, the doors, the windows, it has to fix certain things that are mostly to air conditioning, fans, and those things are not yet done. And we are hoping that once this is also going live, if any institution is listening, the people above can come and help for us to complete the center. But like my medical chief already said, the cases still keep on coming, and we don't know who may need to be moving into the place. And as at now, we can't bring anybody else here because the place is too small.